Hello, my name is Sean Park. I'm South Korean urologist. Let's talk about circumcision. When I was getting my residency, I had a chance to go to the US to attend the AUA meeting. So it's American Urological Association's yearly meeting. It's one of the biggest urology conference in the world. So yeah, I was very excited. It was held in where was it? It was held in Anaheim back then. So Anaheim in California, and it was a huge, gigantic, stadium was there. When I was almost at the gate of the conference, there were people holding a panel talking about, they do not want to take our right not to get a circumcision. So they were anti-circumcision people, like giving a protest, blaming urologists of doing it. Back then, I had no, my opinion back then. I was getting my opinions from my staffs or my professors, my teachers. But anyway, I was a pro-circumcision back then. So I wasn't able to understand them, We always say that in South Korea, most of the circumcision, techniques we learn is from the US. And I thought that in US, everybody was getting the circumcision. But in reality, it was not. Many of them were not getting it. And over the time, I was able to discover that many of them are anti-circumcision. They think that they can lose their sensations or orgasmic feelings or, arousals. And they have many, many bad side effects of the circumcision. They claim it that way. But pro-circumcision guys, of course, we have a weapon in our hands named as a science. So there are a lot of literature saying that it doesn't affect, or many other conversation going on. I'll say not a conversation, it's a debate going on. What I'm now, my opinion toward it, I don't think that circumcision is necessary for everyone. Well, it's up to your choice. After all, it's just a piece of skin, right? Not a skin actually. But anyway, it's just a piece of skin. Whether you cut it or not is entirely up to you. If you want to keep it, you can keep it. If you want to remove it, you can remove it. Get them pretty easily. There may be a patient who is worrying about losing their sensations after the circumcision. Well, over the time, the way I think about the circumcision have changed. So I try to preserve the sensation of those areas by just removing the really outer thin layer of the skin itself, where the skin foliates. So just removing it and preserving the inner tissues of it. Most of my patients doing well with terms of the arousals or sensations. So far, I have no complaint with that. But still, it has been studied with the science, so I can't really say that there's a scientifically proven way of doing it. It takes a little more time. Takes more of my attention, but still I think it can be an alternative for those patients. Like I said, not every patient needs it. There are many patients who will just do just fine without getting it. But there's also a patient who will really need a circumcision. Without getting it, they can have a penile cancer. Penile cancer can only happen to those who didn't get circumcision. So when we were born, our prepuce and our glans was attached. It was mucosal areas, just like my lips, right? It was like my, mucosal areas, but it became more keratinized over the time because it was exposure in the air, right? Same thing happens with the glans, penis, and the prepuce. That's why prepuce was not a skin. It became keratinized over the time, and it looks like a skin, but actually it is just like a tissues in your lips. So they are very fragile and weak. Let's say your prepuce was too tight, but when it gets erected, it will get retracted. And with that kind of tension, it will get a friction, which will give it a scar. When the scar forms, then the prepuce becomes really tight and narrow, and it can't be retracted. It's stuck there. So your glans was somehow keratinized, and suddenly it was covered by your prepuce and it gets stuck there. When it happens for a long time, they will have a very bad inflammation. Then it leads to a balanitis gerotica obliterans, which is a precancerous region. Then it goes to the penile cancer. So those patients whose prepuce becomes really narrow like this, and it chokes your penis, then I recommend them getting a circumcision to prevent catastrophic things like that. We all know that when you have a penile cancer, we sometimes have to amputate it. You're losing your best friend, and you can sometimes threaten your life, so there's really no need of it. But for the most patients, I believe if they do not have symptoms like this, they can get over it. So balanitis, which means the inflammation of the glands or the prepuce, can usually treated with steroid ointments. But too much applying it, we can also, have a problem still. If you want to avoid the circumcision, there's a way you can do it. When you have inflammation in your skin, of course, there's a way to solve it. So we have to adapt to our own situation. And we can also, provide services toward your own intentions how to go. Whether to get it or not, it's entirely up to you. And if you don't want it, there's always a way how to solve it. We can at least try, right? So don't just hold it to yourself, and at least get a good consultation from your urologist. Maybe you will have to get a much unexpectedly good result after that.